It's a lovely evening here in London, and we're about to start our webinar on living well with kidney disease and the emotional impact of COVID-19. So we felt this was a very timely moment to run this webinar. Now we're in our, is it 5th week of lockdown? Feels longer for some of us, but hopefully you haven't been all driven insane by now. So, and I think the guidance has become a lot clearer to us all as to what we should be doing as kidney patients and PKD patients. So Suzanne Whitehead is joining us today. She's a clinical renal psychologist and works at Southmead Hospital in Bristol. She spoke to us at our PKD Information Day that we held in Exeter some months ago now, before we were all locked down, and we asked her to come and do this webinar for us. She not only has experience with supporting kidney patients at all stages, but also she's been supporting her NHS colleagues who are experiencing, as you can imagine, the impact of COVID-19 on their well-being and emotional state. So for those of you new to Zoom or a webinar, haven't used it before, you're in what's called listen-only mode. So you'll be listening to Suzanne speak shortly. And when you want to have a question answered, you can put your question in the Q&A box. Just look at that little button, type your question in there. You can ask your question anonymously. These questions aren't seen by anybody else, but please don't put anything personal or mention if you've got a clinical problem with a doctor or hospital. Don't put anything like that in the Q&A. We will try to answer all the questions before the end, but if there are some that you aren't answered, do send me a follow-up email, info@pkdcharity.org.uk. We'll be recording the webinar and upload it to the PKD website later. So just a quick medical disclaimer. The webinar is for people in the UK. We are making every effort to ensure that what's provided is up to date and correct, but it's not a substitute for professional medical advice or an exam. Please always consult your GP, pharmacist, other medical professional if you've got any concerns about your care or even your child's care. We don't accept liability for errors. We're not promoting or recommending any particular treatment or psychological therapy or any drugs. Our role is purely to support patients and families with PKD, raise awareness and fund research. And if you need any help afterwards, do please contact us via the website or our Facebook group. So with that introduction, and now that we've got a number of people joined us, I'm going to hand over to Suzanne. So Suzanne?
There we go. Thank you very much. Good evening, everyone. I hope you can hear me okay. So my name's Suzanne Whitehead. I'm a clinical psychologist and I work exclusively with people with renal difficulties based at Bristol, and I hope that you find this interesting and useful. So what I thought I would cover tonight is why living with kidney disease puts an extra layer of stress on top of normal life. There's a lot of research that is dedicated to the experience of living with one or more chronic illnesses, and the literature says that people are 2/3 more likely to experience stress than others who don't have significant health problems. I'm also going to talk about the common experiences that people describe, and think about the potential emotional impact related to COVID-19. Obviously research will be happening at the moment about this, so I've drawn on experiences that I've had to date and some literature based on other large scale disasters and the impact of threat and disaster for the population. And then lastly, I'm going to run through some research, what I've learned from people who live with kidney disease, and some psychological strategies that you might find useful. So just starting off with chronic stress, how can chronic stress impact on your health? So stress is something that we all can experience in life. It's a natural human reaction to a difficult situation. So lots of people have heard of the fight, flight or freeze reaction. For example, when you're in a life-threatening situation. The difference between stress and chronic stress is that chronic stress will go on for an extended period of time. So stress may have an immediate reaction in the moment, but chronic stress can have a longer term impact on both our emotional well-being and our physical well-being. For example, people might experience headaches. It might impact on your blood pressure. People might have digestive problems. They may be at higher risk of heart problems. On a more behavioural level, it can affect our eating habits. So we may eat less or may eat more. We may eat more of the wrong sorts of things, the high calorie foods. And it may affect our behaviour. So, for example, related to health, people may just become slightly forgetful about medication, or have a sense that, well, what's the point? Life seems endless and relentless. Therefore, what's the point of taking medication? So stress can lead to a number of different things. So people can become withdrawn, less active, have difficulties getting to sleep, staying asleep or waking up early. People may just describe feeling jittery, on edge, as if something awful is going to happen. So people who live with pain, and this is more related to chronic pain, so may be more sensitive to the burden that pain can put on people when they're under a lot of stress. And people may have thoughts that are difficult, by that I mean negative, and quite overwhelming. So common emotional challenges when you're under stress is a sense of living with uncertainty. People feel as though there's a loss of control in their lives. There may be shifting goalposts. So again, relating this to living with kidney disease. So for some diseases, it's difficult to predict when flares may happen, when deterioration may happen. And so that's unpredictable and difficult to tolerate sometimes. So people may experience a loss of hope, or have a sense that things are always changing. So more so than other people who don't have to live with diseases experience, such as coming to terms with needing to start dialysis, or the huge changes that happen once someone has had a transplant. So some examples of difficult thoughts might be, what's the point? Life will never be the same again. What's going to go wrong next? That's quite a common one, where people feel like they're getting in their stride again, life's going back to normal a little bit, and then there'll be a setback of some sort that means that life changes again. So some people may find that they hit a wall in some way. So they may get to a point where they think, I can't do this anymore, it's just too much. And other people may have a sense that it's their fault in some way because their children are ill. Again, all of these are difficult and negative thoughts that may pop into our minds from time to time. So just thinking about the impact of COVID-19, as Tess said at the start, we're in about week 5, I think, of the lockdown, and I think people are beginning to feel the strain of not seeing family members and friends. There was certainly a lot of uncertainty around what did shielding mean. Should I be shielding? How long should I stay home if I'm worried about symptoms? And not only what does shielding mean for me, but also other members of the household. So should my daughter go to work, for example? So lots of unanswered and anxiety-provoking questions. People might wonder how they're going to get their shopping, how they're going to get to their normal and essential health care checks. How do you go in and have your blood taken? And how will you get a repeat prescription or a specialist prescription from the hospital? So from my experience in Bristol, I've been quite impressed with how rapidly and quickly, I guess, that they have changed the clinic so that people are as safe as possible to attend. But again, if you aren't aware of that and you haven't seen that happen in the hospital and are called in for an appointment, then it is understandable that people may be worried. So some people may also not be sure if you can have visitors in hospital. So I put the what else point there because I'd be quite interested to hear if there are other things that people have noticed around the restrictions that we're all experiencing with COVID-19, but particularly related to your health. So I just wanted to, I will come on to this later on, but two other important factors when we're thinking about the longer term impact of COVID-19 is potentially thinking about loss and bereavement, and also traumatic experiences. So I just wanted to quickly run through probably quite a well-known model by Kubler-Ross that she described in '69, and it's been added to and revised. So it was a 5-stage theory, and it's got 2 extra stages now. So the initial part, well, the 2 initial parts, shock and denial, are a way of describing quite protective mechanisms to stop us in the moment of a significant loss becoming too overwhelmed. So people talk about shock and denial in quite negative ways, but actually they are effective in alleviating becoming totally overwhelmed by the impact of what's just happened. So denial, some people may, for example, just be disbelieving that someone has passed away, or it may be about pushing away feelings that are too difficult to be experienced at the time. And people often talk about feeling quite numb. So these are all experiences that are very normal and usual, just useful to be aware that they might happen and to recognise them. So anger ideas are, it's not fair. People might blame others about some aspect of the loss, and often question, why me? Why did this happen to me? Why did this happen to my loved one? So bargaining describes a scenario where people almost want to make a deal with God. So if I live my life in a better way, if I become a better person, then don't let this happen, don't let this awful thing happen. So it can be described as people seeking in a way for a way out of what is a very difficult situation. Lots of what if questions come up in this stage and are and often a strong feeling of guilt at times. So the next stage is depression, and this is described in the literature as when reality really hits and the impact of the loss becomes overwhelming. And this often represents a sense of emptiness, that the loved person has gone, and what does the person do with this sense of despair in the face of the loss? So again, people may get to a point of thinking, what's the point of going on? Because actually at that point, which is why it's called depression, people can't see a way forward. So it's not always at that point being able to see the full picture that there may be steps forward. So testing is about, again, this is the extra stage that was added to Kubler-Ross's original theory. It is all about trying things out. So testing out, can I do things by myself? Can I drive that long journey that my husband used to? Can I look at the finances and make a head nor tail of them? All of those little things that perhaps the person may have relied on the other person for. It is testing to see whether life can carry on. And then acceptance is not about, it is okay that my husband passed away, but more around he did pass away and I'm going to be okay. So at this point, people slowly begin to be able to re-engage with life. They feel comfortable to see friends, comfortable to spend time with other people, and there's a sense that life moves on a little bit. So I'll come back to grief a little bit later on. So traumatic experiences. Now, working in an acute medical setting, the sorts of experiences some people may have that would lead to post-traumatic stress disorder are admissions to intensive care, and experiences of hospital procedures. So some people may have had quite difficult experiences, for example, with a transplant or a biopsy, and actually when they need to consider putting themselves back on the list or having another similar procedure, then they will get overwhelmed by certain experiences. So I'm just going to run through what the post-traumatic stress disorder indicators might look like. So I'm not hoping that you're trying to diagnose yourself, just to raise awareness that these things you might notice in other people and who are struggling to manage. So some of the intrusive symptoms are nightmares, flashbacks, which are where it's as if you're taken back to the worst situation, the worst clip of an image. Emotional distress, when you're exposed to traumatic reminders. So for some people, going back into medi rooms, going back into theatre, or even walking back into the hospital will really shake them to the core. So unwanted upsetting memories, that's again, so just when you're relaxing, suddenly you're remembering something about the incident that seems to come out of the blue. And then a physical reactivity, so again, so going into the hospital and suddenly feeling almost like you're having a panic attack, that may be linked to the difficult incident that happened. So generally people would have been exposed to an actual or a threatened serious injury, or a sense that they may be in a situation where they've died. For some people, they can have just witnessed it or heard about the incident, and that is enough for people to develop post-traumatic stress disorder in this scenario. So lots of people would have known somebody who's been in a car accident. That's quite a common good example to use, and So in that moment, the person may have thought at the point of impact, either my loved one or I may not survive this. So, so related to PTSD, so some people will avoid the trauma-related stimuli. Sorry, that's a bit technical. So it's either thoughts and feelings about being in ICU, or it might be external reminders. So things like going to the hospital. So for the car accident, people often will avoid driving at the past or to the point at which the impact happened, which is again very understandable. So people may have negative thoughts and feelings that get worse after the incident. So they may, for example, blame others or themselves in an exaggerated way for the incident, or not have a patchy memory of key features of it. Again, that's quite common having if people have been in intensive care, because they may have had strong medication or been temporarily sedated. So alterations in arousal, so people may be irritable or aggressive, unusually for them. They may start behaving in ways that seem risky or self-destructive, for example, alcohol use. They may become hypervigilant, so looking out for the next thing that might happen. So particularly, again, car accidents, people are very nervous about being in a car, being a passenger, understandably, again. People may have a particularly exaggerated startle reaction in certain situations and struggle with concentration and sleep. So just moving on to common reactions to difficult times. So just moving back to thinking about living with a long-term illness. So people who seem to get to the point of acceptance or living well have a different perspective on life. So they have courage, they are resilient. So when I talk about resilience, it's not a trait, it's a process by which a person is able to cope with or adapt to life events when they face adversity, and they're more able to bounce back from things that have been overwhelming. So fitting in with that, people are able to cope and adjust to new things that really they didn't ever think they would need to be dealing with. So people could take things in their stride, reevaluate their priorities. People often talk about how just spending a lovely afternoon with their grandchildren is so very important, or going to the beach and watching the sea with a cup of tea with their husband, that takes on new meaning and value. And people also are very good at navigating their way around the NHS and different sorts of support systems. So just moving on to some of the psychological approaches that are used. I'm going to do a whistle-stop tour of some of the approaches that you might find interesting or you may already know about. So starting off with cognitive behavioural therapy. So this is all about how our thoughts affect our feelings and affect our behaviours. So just to put this into an example. So if someone were to think, everything is hopeless, my life is over, they may feel very stressed, angry, worried, down. And as a result of that thought and those feelings, may decide to stop going to work, just become more withdrawn, perhaps not go to meetings because what's the point? Maybe again forget to take medication. So we can't stop the thoughts that are coming into our heads, and particularly this relates to the negative thoughts that are up there. So everything's hopeless. but we can become more aware of the thoughts and actually look at them and test them out, see if they are explaining the full picture. Are they useful and effective at this moment? And what impact is it having on our behaviour? So I said a little bit of that, haven't I already? We can't stop the thoughts coming into our heads. We can capture them and see if they're the full picture or helpful. So just in terms of thinking using the CBT model, some questions might be, what are the doctors worried about? So often people who are feeling quite anxious will worry about a lot of things that actually the doctors may not hold as important. So having someone else's perspective to hold on to helps quell some of the worries. How have I coped with difficult times at other points? So people often forget how they've been through difficult times, and it's useful to remember what helps that individual get through. Am I overestimating the chances of something going wrong in the future? And thinking about setbacks. So what might help in this situation, or who can I ask for help? So just thinking about in the moment right now, is what I'm doing helpful? So being withdrawn versus talking to the right person. So not talking to everyone, but it's finding the right person for that moment. People often have worries about the future. Again, this fits very well with COVID. Just huge uncertainties around, like I said earlier, getting shopping, possible illness, and maybe perhaps the media generated an awful lot of worry. So often when that happens, it is helpful to think about right here and right now, what am I doing? What is in my control, and what can I be getting on with? So what are they suggesting about hand washing, about shielding? What is it that I can do now? And try and refocus your mind on the now rather than the future. So if people are looking after themselves less well, then can they set small achievable tasks to improve your overall health? So the idea with CBT is to become aware of the impact of feelings. How do I feel? How am I behaving as a result of these feelings? How can I express my feelings in a helpful way, and who to? What can I do to look after myself when I'm struggling? Who is best to talk to right now? So, and maybe acknowledging that it's the illness that perhaps the person is feeling cross about, rather than actually friends or family. So there's a model where the idea is that there are 3 emotion systems going on in our brains. That is quite an interesting one that I wanted to just talk through. So the idea is that we have 3 different modes of being. So threat, drive, and soothe. So when we're in drive mode, we are going about our daily business. We are motivated to do what we like. We are busy at work, and we're task orientated. When we're in threat mode, we're feeling anxious. We may not have all of our normal abilities to cope with stress because we're feeling threatened, and we may feel anxious and irritable. When we're in soothing mode, we are doing things that we enjoy. So activities without any goal necessarily, but things that we actually enjoy, and also things that connect us to other people. So sitting and watching a television program with other people that you're enjoying together and laughing and sharing jokes about. So the idea with this, these 3 systems that are going on is that, understandably, in the COVID situation, we've been largely threat and drive have been quite strong. And when certain systems are outbalancing the other one, that's when we begin to flag and we get ourselves tired, or our emotions are all over the place a little bit. So the idea is just to pay attention to which sort of emotion system you're in the moment. And if you're feeling threatened, then perhaps actively spending some time soothing yourself, or planning what to do with the day by going back into drive, might help balance out any difficulties. So do ask about that later if that would be useful. So compassion is the other quite popular idea around at the moment in psychology. So there is, again, from the Dalai Lama, this is described as a sensitivity to the suffering of ourselves and others, with a commitment to try and relieve it. So there's a sense of, rather than being self-critical or unkind to ourselves and others, that we can make an awareness that people or ourselves are in pain, and that it is kind and compassionate to reach out to try and relieve that, either for ourselves or other people. So just briefly, the ideas here are to develop a compassionate mind. So learn to become sensitive to things that cause us difficulty or pain, and turn towards these difficulties rather than away, so that we can learn to begin to tolerate distress. So often we're told that distraction is really helpful, and it is, but also learning to be able to tolerate things that are quite possibly going to continue, for example, long-term pain, so fatigue, being able to find strategies to manage those is useful, and will improve the quality of our lives. That's the sense here. And also to use a non-judgmental and accepting type of perspective. So also, to develop a compassionate mind, we are working to alleviate suffering with kindness and compassion, and move towards a genuine wish for us to be better. So there's a commitment to look after ourselves. People are often quite busy looking after other people, and it kind of feels a bit odd to look after ourselves, but it can be effective in terms of our own well-being, emotional well-being. So it's also seeing that kindness and care is courage, not a sign of weakness, and to be motivated to help ourselves and to help other people. So people may have heard of mindfulness. So John Kabat-Zinn has written a lot about this, and this is about paying attention to the present moment without judgment. So it is about, rather than thinking about the past or the future, being able to spend some time thinking, what am I doing right now? How am I sitting in my seat? Does my body feel comfortable? Do I feel warm enough? So drawing our attention to what we're doing immediately can calm our minds if in particular we are worried about the future or something that's happened in the past. And it is a skill to learn, and there are lots of techniques to help with this. So it is about directing our attention to the here and now, and being aware of what's going on now, right now. So if you're interested, there is a breathing meditation that you can access through Headspace. I'll just put the link on there. And just this little clip is, again, another kind of idea of the person on the left is busy thinking about their day, and the dog on the right is just looking at the scene that's there. So the aim is to be more aware of what's happening now rather than our minds full and busy. So relaxation. I'm just going to run through these, but relaxation is so very important, again, to help with chronic stress and to help with many different negative emotions. So the key is to do things that you enjoy and that you feel you're good at, and also activities to physically calm the body. So muscular progressive relaxation is where you tense and relax your muscles, and practicing doing that 2 or 3 times a week, because it's another skill to learn. Just like yoga and meditation, it needs practice before you get to see the benefits. And so raising awareness of worrying thoughts. So again, this fits a little bit in with the mindfulness ideas that if you switch your attention towards rather than away from worrying thoughts, that can often help them to be more acceptable, less distressing. So also within relaxation, so visualization can be helpful. So the happy or safe place idea is, for example, if people are feeling very anxious before a procedure, then where is it that you are the most happy or at peace? And the idea is to think of somewhere where you are alone. So it might be a beach or by a river. Most people's is outside. And it's important that it is alone, so that actually you're not relying on other people to be there, and just to really immerse yourself in that image. And then when you are somewhere where you're struggling with anxiety, to try and remind yourself of what being in that happy or safe place felt like can be a good technique. Okay, resilience. So as I mentioned earlier, resilience is something to learn, that we can all learn. So it means, like I said earlier, that people can face positive and negative life events, can persist in the face of obstacles, and also accept where things cannot be changed. So I hope you can see where that might be relevant with living well with an illness. So some of the ideas about developing resilience is to think about what are your personal strengths. So you may like to do things for other people so that they feel good. Another idea is to think about what you do, one thing that you do every day that you really want to do. So it might be gardening, for example. What is it about that activity that really drives you and makes you interested? So I'm just aware that time is rolling on, and I may just speed up a little bit with some of this. So hopefully you can ask some questions at the end, so I can answer what the ideas around resilience are. So the broad idea is that people are helped to develop a personal model of resilience. So it is something individual to you, and it's a reminder that people have got over difficulties in the past and can do that again, and to practice what strategies work well for you for everyday difficulties. So hosting meetings, doing presentations, having difficult conversations in the family, for example. What things help you to be effective and to master those. So just coming back to loss. So again, this is just a reminder that some people may experience bereavement in the next few weeks and months, or may already have, and being aware of the normal experiences that make up grief can be really valuable, and it does really take time to go through these stages. You don't go through all of them necessarily, but sometimes being able to label things can help the process. So sleep, I am going to skip these slides because there's lots of information out there about what sleep, how to improve sleep. So sleep is really important. It's the basis of the good emotional health. But I will just leave you to read those slides at another point. Okay, so I'm going to pass back, I think, now to question and answer time.
Thank you, Suzanne. So we've had a question already in the Q&A box. You just open up the Q&A box, you can see that one. Whilst you're just closing your slides down.
Oh, I'll close my slides?
Yeah.
Okay, yeah.
And can you see the Q&A box?
Not yet, sorry, it's working to close.
I'll ask you the question while...
Yes, do.
This is a question, how do you suggest we help people who have completely lost any motivation for drive and to help them soothe themselves?
Yes. It's very personal. So when people have lost drive, there will be some reason why that's happened. And being able to remember what people are good at, what they used to enjoy, for example. Sorry, I'm just doing a few things while I'm answering. So remembering what you're good at, doing enjoyable things is so very important to feeling as though you're you again. And sometimes people need to be reminded of that and encouraged. And spending a lot of time soothing. It sounds really odd, doesn't it? And how do we do that when we can't go out at the moment? There are so many activities that are soothing, and it's very individual. So it won't mean kind of lying on a couch and being fed grapes by someone, but it might be more about if you're an active person, then what are the activities that you enjoy doing without putting pressure on yourself to achieve them? So and I guess people do need to a bit of help to be reminded of what they seem to enjoy doing, and then think, well, is it better to try that than actually just carry on feeling awful and staying in bed, or not doing anything? Because it can be a slow process to find your motivation again. I hope that answers the question.
You see the second question, Suzanne?
So is it, how do you suggest? No.
Yeah.
Sure, it's about signposting if needed. What supports? Yes, absolutely. It is useful to know what's out there. So I'm biased because I'm a psychologist, so therapy is very useful, but I'm also very aware that timing's really important, and not everyone feels comfortable to go and talk to someone. It can feel quite odd. So I would say, with the statistics, that 1/3 of people who come for therapy get fully better, 1/3 get slightly better, and 1/3 it does nothing for. So actually finding your own way through can be really important too. So
another question about sheltering.
So if sheltering goes on indefinitely for some people, how can people cope mentally? Yes. So that is that shifting of goalposts, isn't it? And we're all hoping that things will, Boris will tell us when we can go out again, but it is very uncertain. There are so many things people can do to improve their daily routine. I think people have been really amazing at using social media in positive ways. So connecting with families regularly, connecting with friends. People are doing all sorts of quizzes now and trying to find new ways of finding a new normal in lockdown. So it is uncertain, and watching 24-hour news is kind of really unhelpful, because it just fills us with that doom and gloom all the time, and the fear of the future, and actually thinking about what we can do right now and what we've got control over right now, so we can choose how we spend our day. We can hope that the weather's good enough to get out for a walk, or to go into on your balcony or in the garden if possible. So I would say it's about focusing on things that you can do and really good routine. I hope that's okay for that one. So somebody's asked, could you talk a little bit about the changes to your hospital procedure in the light of Corona? You said it was very quick, but I'm interested to hear more. Also, we have a PKD appointment on Monday. Oh, with the renal consultant, and not sure if it's going ahead as normal. Okay, so I can't answer for you personally. So in Bristol, our consultants came in at the weekend. I think I think just after the schools closed, and cancelled a huge number of outpatient clinics for people that they considered safe enough to not come into the hospital. So they've, I mean, there have been several weeks where it's been unclear, and things have changed a lot in terms of what's okay to do, what's not okay to do. But I do think they're in quite a good routine now. So the chairs are socially spaced, the clinics are spaced apart so that people aren't waiting in areas unsafely. All the staff have got the correct masks, and you know, for blood tests that have to carry on, then they're also done correctly. As much telephone and Zoom type appointments are happening as well. So from if you were someone in Bristol coming to see a renal patient and it was on Monday, you would have been told by now that it was non-essential. So they are doing it weeks in advance. So even though people feel quite uncertain, unsafe about coming to the hospitals, some hospitals have got separate entrances, for example. But I would more than likely think that the doctors feel it is essential for you to go if you haven't heard it's cancelled. I hope that makes sense. So someone else, I live alone and am in the shielded group, and I am really struggling with the sudden loss of independence. Yes, usually I'm able to live a full and independent life, but now I cannot even get a slot. Oh yes, for online shopping. So I must rely on my kind friends. Any thoughts on how I can manage this, please? It is so very difficult for independence, isn't it? It's debilitating. It's similar to how people describe going into hospital, where you know, you eat your lunch and your meals in bed, which is not normal, really, is it? And people do things to you, come into your room without knocking. So what can I say? I guess from some of the psychological ideas, the idea would be that actually it is a really important thing to be able to ask for help and accept it. And I know that some people find it difficult to be the receiver of help rather than the giver of help. And sometimes it's useful to think about what is the person who is helping you out feeling about doing that, and they will be doing it for good reasons and feel quite they'll be getting benefits from helping you. So I don't know if that helps to think of it. If you were in their shoes, what would you do to help you? And I'm guessing more than likely you would also be shopping and dropping things off and waving and saying hello through the window. I don't think that's a life-changing answer, but I hope that it's helpful to think that other people are doing this because they really care about you, and being able to think of ways, I guess, to repay that, not financially, but just through kind wishes or in some way in the future, will be well received. Okay, shall I go on to the next question? So I'm newly diagnosed and now have a long wait before a consultant appointment. Pushed back from May for 6 months. Yes, very difficult. Best methods for coping with this level of uncertainty. It's very difficult, isn't it? So you must have so many questions at this moment, and quite possibly be a little bit shocked at being diagnosed. So from one way, I'm guessing that because your appointment's been pushed back for 6 months, they feel safe that that's safe for you in terms of your physical health. And if you're like most people, you will want a few answers. So I would encourage you to go to some well-respected and legitimate websites to ask questions. There are helplines that you can look at. There are websites, for example, Guy and St Thomas have a very good kidney website that I quite like. I'm sure Tess has got lots of other suggestions as well, but possibly trying to be linked up to other people who are living with a similar disease can be really invaluable. And that, what am I supposed to be doing now? So if are they suggesting I carry on taking my medication, or do I need to pay attention to my diet? So it's the what can I do here and now, rather than what's going to happen in the next few months or years. That's quite important to focus on what you're in control of rather than what you're not, because our mind can play tricks on us and we can go to the worst case scenario quite quickly sometimes, which is stressful. I hope that's okay to answer that question. Funny when you don't get feedback from answers, isn't it? Okay, so the next one. So my healthy diet is non-existent and I'm not as active. How and where can I find a guide in healthy eating for PKD patients? I'm feeling anxious from eating more junk food. I'm not going out to the shops like I usually would to help me feel inspired seeing healthy food. I'm working from home and limited to prep time for food. I feel sluggish and unhealthy. Yes, okay. I think that's probably similar for a lot of people. So again, I might leave which website to go to for Tess to answer actually. So from that, some thoughts that I'd have is if you are if you've fallen out of good habits, it's remembering what worked and thinking of one or two things that you can start doing. So if, for example, you like to cook a certain meal that's nice and healthy and you enjoy doing it and you're good at it, then I would suggest just doing that once a week. So it's really important to think about goals that are achievable rather than going from completely off track to completely on track, because that's not doable. So just introduce a couple of things. You might want to make a plan for the week, but I do encourage you not to beat yourself up when you go off track, because these are unprecedented times. We're all finding a new way of living in very strange times, and that's where the self-compassion comes back into play. That's so important. There's no point beating yourself up for eating junk food, because I think a lot of the population are. So it's more about, right, what can I do tomorrow? What small changes can I do? And then simply building on those. And if you don't have time to prep, then batch cooking or just introducing a few more things that are your old, normal, healthy diet might be helpful to think about as well. Okay.
Thanks, Suzanne. Yes, I would add that the question was a diet for PKD patients, and as we know, there isn't really a PKD diet. There are diets that are suitable for patients at different stages of kidney disease, and usually that's driven by blood tests, as you'll know, as well. So we when people ask us about the PKD diet and we know they haven't got kidney failure or they haven't been told to change their diet, we always just like to stress the normal balanced healthy diet, keeping hydrated, reducing sodium, and all those things. There's no sort of magic diet out there. I'd love to have one, but there isn't, and it can be sometimes hard to explain that to people, because diet, control of your food, is often something that people have control of and feel that can help them to cope in some way because of the uncertainties of having an inherited lifelong condition. So yeah. Right, there were a couple of people who put their hand up and one had a question, and hopefully they've had theirs answered by now. Just checking the chat box. There's somebody who asked a question about getting a copy of the slides. We will be putting the slides up on the website as well. Suzanne's allowed us to do that. And of course, if there's anything that comes to mind afterwards, please don't hesitate to contact us and we can pass them on to Suzanne. Is that all right, Suzanne?
Yes.
For you to, if there's anything that you can, signpost
email,
people,
yes,
help,
sure.
signpost people.
Yes, absolutely.
I was just contemplating when you were presenting the different approaches, how do you actually decide which approach is right for which the person in front of you? But I guess that's your experience, isn't it? You get a sense of what might work with a person.
Yes, definitely, and I guess how they talk, so you can pick up on what sort of model might seem most acceptable. Some people can't get their heads around mindfulness or compassion, which is fine. So that's not essential. It's more working to see some improvement.
We just had one more question that came in. We can go on a couple more minutes if you're all right, Suzanne.
Sure.
So that's if you can see that question that's just come in.
So I'm a transplant patient who's shielding, but it almost seems pointless in a way, as scientists claim that we are all going to get COVID at some point. I'm fearful of catching it at some stage, and that's worrying. Yes, it is worrying. I do accept that, and if you've been told that you're at higher risk than other people, then that obviously adds to your anxiety levels. It's so very difficult, isn't it? Because I think there's a lot in the media about that is debated, and we're quite open to the debates. We can hear them as much as we like. So I'm not 100% sure that it's carte blanche that everyone will experience COVID. So I'm not aware of that train of thought. So I would try and think about what is it you can do at the moment to keep it as safe as possible, and follow the guidance that they are putting out there. It is completely understandable to be worried, but kind of feeling as if it's pointless may lead to some kind of unhelpful behaviours of just giving up. So you may feel like that, but that I'm hoping that there is hope. So we're at the point, aren't we? We're only 5 weeks in. We haven't seen that figures are going down. It's how to kind of dig in and not keep positive, but keep realistic, I guess. I do strongly recommend people not watch the news all the time, because it just veers us into future possibilities. So if you're well and safe and shielding now, you're doing the best you can.
Thank you. So on that hopeful and positive note, I'd like to thank Suzanne for your time tonight, this evening, and for also the time you spent preparing the slides for us. And thank you everybody who attended, and thank you for your questions. So that's it. I'll be sending around an email afterwards just to ask your feedback, which helps us with future webinars, and speak to you all soon. Bye now, and have a good evening. Bye.